All right, so we're back. We're going to go to the first part of the muscle lecture. So it's going to be the muscles of the body, part one. Okay, there's three parts of that. So we're going to do the part one today. And it's going to be axial muscles, anything in the middle. That's going to be our part one lecture. Okay, so let me open it up. Okay, let me reshare it so it's sure that it's actually the first one. Okay. All right, so we have the part one of your lecture, and let me actually turn on my pen. Okay, and you should be able to see my writing there. Okay. All right, so we're gonna go through the first part. Okay, and we're gonna take a look at the muscles here first. Okay, so again, I said, you gotta use landmarks whenever you actually use study anatomy. Okay, so if you take a look at the muscles that you see here on this slide, okay, I'm looking at the front thigh. Okay, so the front thigh first. I can actually make up a muscle that spells out the letter N, end to end. I'm going to use that as my landmark. So if I see this three muscles, I'm the one with the thigh, okay? So the first one is going to be this muscle here. That is the tensor fasciae latae muscle, okay? It connects end to end with the next muscle here that's called your sartorius muscle. It's going to be your sartorius muscle. And then after that, it connects end to end again with another muscle here. That is going to be the gracilis muscle. So the three muscles make up the letter N, all your thigh, okay? And that's how we actually start off, is try to get a lot of this landmarks so you don't get confused, okay? Because later on, you can actually see a piece of the part of the model of the body, and you have to determine if it's the arm, the leg, the thigh, okay, or the forearm, okay? So that's actually one of the technique that's important to master, okay? So I got that letter N as my landmark, okay? And then I have one here, the arm. This part here, you can feel that on the thumb side, close to the proximal side of the forearm, okay? And that's gonna be your brachioradialis muscle. That's gonna be our landmark. The brachioradialis muscle, that bump that you'll see close to the thumb on the proximal side of the forearm, that is going to be your brachioradialis muscles. So it's located here, okay? Thumb side, all right? That's going to be a landmark. Now, for the first part of the muscle that we're going to be studying, we're going to study the axial skeleton. Axial skeleton are everything that you see here, okay? And up to here, okay? Not here. This is shoulder, so that's going to be part of the appendicular. So the axial muscle is anything in the middle of our model, okay? So I could divide the muscles in the axial muscle into muscles of the head, okay? So I'm going to divide it to the muscle of the head. Then after that, muscles of the neck. And after the muscle of the neck, muscles of the chest. And then the muscle of your abdomen. And then on a head, I can further divide it into two parts. The scalp and the face. Okay, so that's going to be on the front side. That's how you're going to be dividing it. And then here is going to be the posterior side. Okay, so again, the division is going to be somewhere here. All of this are eggshell. Okay, and you're going to put the head which is mostly the scalp, are located here. You don't see facial muscles at the back of your head, okay? This is gonna be the scalp, right? And then you have the posterior neck. Then after the posterior neck, you're gonna have the upper back. Then you have the lower back. Okay, so once we finish your eggshell, okay, we're gonna go now into your appendicular, okay? So let me actually remove that so I can show you the appendicular. The appendicular muscle is located at the girdle called the scapula. Then arm, forearm. And we're not gonna go deep into the hand, okay? There's a lot of muscles in there. Then for the pelvic girdle, on the posterior end is going to be the gluteus. Then we have the thigh, and we have the leg. We're not going to go into the deep muscles of the foot, okay? Right, so those are the divisions. And also here onto the anterior part, the division is going to be the appendicular. So I'm going to go to the appendicular, the girdles, the pectoral girdle, then the arm, and forearm, okay? And then here is going to be the thigh, okay? Remember, you don't have gluteus on the front. You don't have that muscle that's located here that is a part of the the pelvic girdle. And then from there, we're going to do the leg, okay? So we're going to do systematic study of the muscle, okay? So we don't just go all over the place and identify all the muscles at random, okay? Right, so we're gonna start with the face. From this time on, okay, you're gonna associate nerves with the muscles, okay? You're gonna associate nerves with the muscle. Now, the muscle on the face, okay, the purpose of the muscle of the face is for facial expression, okay? So it lies on the face, okay, but also the scalp, but we're dividing the scalp as a separate muscle because that's the one on your top portion of your cranium. But the reason why it's part of it is because they're actually innervated by the same nerve, cranial nerve 7. It's called the facial nerve, okay? It's called the facial nerve. So the facial muscles with a facial nerve, cranial nerve 7, okay? So again, once we go to the nervous system, you can actually remember cranial nerve 7 as a nerve innervation to the facial muscles, okay? So just remember, when you win the jackpot on your slot machine, what number comes out? 777. And then after that, you smile, right? So that's actually the way to memorize it, okay? Most of the muscles there are thin and variable in shape, okay? And then it's often inserts in the skin, not on the bone. They don't actually insert on bones. They came from bone, they insert on the skin. And the only thing it does is facial expression. And you'll actually notice that they'll be actually going down to the lips. And that's going to be the most common scenario of the muscles of the face, okay? So we're going to start with this muscle here, okay? So this is going to be the typical way to study the muscle of the head, okay? So the muscle of the head, first thing is I'm going to get this muscle here on top of your scalp. This is the muscle on the scalp, okay? So just remember, this muscle, the scalp, is soft. It doesn't really attach well into the cranium, okay? You'll see it later on. So this is actually just one whole muscle. Sometimes the name of that muscle, the whole muscle, is called the epicranius muscle, okay? So they can be divided into the frontal part called the frontalis muscle. And the one in the back is going to be the occipitalis muscle. And they're connected through what we call the gallia aponeurotica, okay? It's going to be the gallia preneurotica. So it's literally just one muscle in the scalp, okay? And that's going to be the first muscle that we're going to be studying, okay? So I'm going to actually show you what it meant by it's not attached to the scalp, okay? So this is a person who had an accident, okay? And this is what happened. So there was a person riding the Ferris wheel, I think in South America, and her hair got caught in a stationary object, and it pulled her scalp away from his cranium. You can actually see the eyebrow still in here, okay? So the whole thing is actually called the epicranius muscle that is actually below the scalp, okay, where the hair is attached. So again, that's how smooth, that's how easy that you can actually pull out that scalp hair, muscle, okay? So that's called the epicranius muscle. We're gonna move into the identification of that muscle first, okay? The muscle of the face and the scalp before we go forward. So this is gonna be your typical model that you're gonna be using for identification of the muscle of the face. So the muscle of the face, what I'm gonna do is put a clock, okay? I'm gonna put a line here and a line here. I'm gonna use this as 12 o'clock, 6 o'clock, it's gonna be 3 o'clock, it's gonna be 9 o'clock, okay? So again, make it easy is to actually put it in a grid, make it easier. Now, the first muscle that you will notice on the face, you got two round muscles there, okay? One covering the cavity of the eye, and the one covering the mouth, okay? So this is gonna be your muscle around the eye. It's called orbicularis, meaning round, oculi, okay? That is gonna be the muscle of the one covering the eye, okay? But remember, that muscle shuts close your eye when you close it out, okay? Winking is not the function of this muscle. Winking is a different muscle. It is called the levator palpebrae muscle. It's actually on your eyelid. It's a different muscle. If you want to use that, you can wink. But if you want to shut your eye, that's actually how you shut your eye, which is through the orbicularis oculi. And then the mouth is going to be the orbicularis oris. Oris means mouth in Latin, okay? The oris means mouth in Latin. So you got the two muscles, round muscles. Then after that, I want to take a look at the muscles. If you actually see the muscles, they go into the lip, okay? Because remember, what's the purpose of that facial muscle? Facial muscle is literally to move the lips in order to produce what we call facial expression, okay? And that's the reason why we call it a facial muscle. So I'm going to use this as a way to identify all the things I need in that facial muscle. So the first one is going to be at 1 o'clock. So my clock is at 1 o'clock, okay? The muscle where it hits that 1 o'clock, this muscle here, and it's going to be the levator labii superioris, okay? So remember, the way of the naming muscle is actually, it shows you about the function of the muscle and the location. So what it does is it actually elevates the lips. Labii means lips, okay? It elevates the lips. Like if you want to smile or smirk a little bit, that is what the levator labii superioris does. Superioris, meaning above. Why? Because later on, you're going to see one that is below, and we're going to call that inferioris, okay? So that's the first muscle at 1 o'clock, levator labii superioris, okay? Now at 2 o'clock, I'm going to have two muscles there. At 2 o'clock, I'm going to have the zygomaticus. I got the major and the minor, okay? The major is bigger, the minor is smaller, okay? The major is bigger and the minor is smaller. This is going to be your minor. This is your major, okay? Now, so it also tells you where it is located at, okay? So we call the muscle zygomaticus. So that means that that muscle actually came here from the zygomatic bone. So this is the zygomatic bone. So the muscle actually is originates from the zygomatic bone and inserts into the lips. And that's the reason why they call it a zygomaticus. Okay. Now, later on, you may get confused who's number one and who's number two. Who is the levator labii superioris and who's the zygomaticus muscle. Remember, the zygomaticus muscle, look for it where it actually came from, the zygomatic bone. The number one muscle, the levator labii superioris, it actually came a little bit below in the middle of this orbicularis oculi. So when I see that, it confirms it is the levator labii superioris. The zygomaticus muscles, they're located, started out from the zygomatic bone. Okay, so we need to do visualization. And then the next one is going to be the muscle that goes horizontal straight to the corner of the lip. That muscle is called the rhizorius muscle. Okay, so it's called the rhizorius muscle. Rhizor means laugh in Latin. Okay, so that's called the rhizorius muscle. So if you pull that muscle, you're going to be smiling. Okay, again, that is going to be the muscle at 3 o'clock. So next, I'm going to go at the muscle at 4 o'clock. I'm at the angle of the lip. So the angle of the lip. So I'm going to use the word angle, anguli. Okay, it's on the mouth, so it's going to be called anguli oris, and it's at the bottom. So I'm going to call it depressor anguli oris. So that's actually when you want to show your face that's sad, you actually use that depressor anguli oris. Okay, and that's going to be at 5 o'clock. And I got one. That was on 4 o'clock. Okay, I got one here at 5 o'clock. This one's at 5 o'clock. That is going to be your depressor labii inferioris. Okay, and remember, that was something opposite to the levator labii superioris. Okay, is at 5, is at 1. So those are actually the two muscles that you can actually associate with. They're doing opposite function. And then the last one is at 6 o'clock. Okay, and that's going to be the mentalis muscle. The mentalis muscle is the one in the middle of your chin. Okay, sometimes the mentalis muscle is separated in between, so you have this cleft, they call it cleft chin. Okay, so we got a separated two muscles there in between the chin. Okay, but most would only have one, and that is the mentalis muscle, right? And that finish up all the muscles of the face. What cranial nerve? Cranial nerve 7, the facial nerve. Okay, so that's how we study the muscle of the face. Now, I'm going to move now to the muscle a little bit behind the face. So I'm going to remove this label, but we're going to actually use another picture later on. So this muscle here, okay, actually connects to the inside. So it goes inside and it connects into the mandible. Since it's located at the temporal bone, I'm going to call it the temporalis muscle. Okay, and that muscle here that you see here at the side of the maxillary, it inserts at the, it actually inserts at with the angle of the mandible. Okay, so I'm going to call that muscle the masseter muscle. So I got two obvious muscles here that are visible. There's going to be two that are going to be inner, and we'll see that in a different picture. But the temporalis muscle and your masseter muscle is the muscle of mastication, or muscle for chewing. Okay, there's going to be two more that will be seen later on. Once we take off the mandible, you can actually see the two muscles inside. But definitely, these are your muscle of mastication, the temporalis and the masseter. There's one muscle here that is not actually going to be part of the facial muscle, and this is underneath the rhizorius. That is called the buccinator. Okay, so the buccinator muscle is underneath the rhizorius. It's actually considered as part of the muscle of mastication because when you suck a straw, that's exactly what you use, the buccinator muscle. Okay, so they actually consider it as part of the muscle of mastication. The only difference is the muscle of mastication is cranial nerve 5, trigeminal. But the buccinator is cranial nerve 7. So they're actually part of the muscle of the face group. Okay, but it's not being used for that. That is actually being used for sucking a straw, which is actually for eating, right? So that's just one thing on this picture. Okay, so now let's go on to the muscle of mastication. And then later on, we're going to see the tongue movement muscle. So we're moving to the muscle of mastication. The nerve innervation for that is cranial nerve 5. Okay, so how do you remember that? Remember there's a 5 gum. Okay, so now if you know there's a 5 gum, then that's going to be the cranial nerve 5 for the muscle of mastication. We're chewing. You're going to chew on a gum. And also the word trigeminal. 3 twins equals 5. Trigeminal. Okay, so don't take for granted any of these names. Okay, don't just memorize per se. You have to actually figure it out because that's actually the way that we actually study it, in which we have to find ourselves a landmark or a clue. Okay, so we can actually recall the information after. So they're actually the prime movers of jaw closure, called masseter and temporalis. But the side-to-side movement is by the pterygoids. We're going to see that later on. Side-to-side movement of the mouth. Okay, and then the buccinator, that's for compression of the cheeks. But remember, this is cranial nerve 7. Okay, now let's move on to the next one. This is where it gives you the picture of the muscle of mastication. So the temporalis muscle inserts at the area of the mandible called the coronoid process. Remember the sharp portion there, okay, of the mandible? That's actually where it inserts, okay? The other one is going to be coming out from this part here, which is actually literally part of the maxilla and the part of the zygomatic. It actually goes down to the part of the mandible called the angle, mandibular angle. Okay, and that's where it actually inserts. So if you take a look at your visuals about the muscle, you know it will actually move the mandible. Okay, and that's what the muscle for mastication is for, the masseter and the temporalis muscle. Now, if I actually cut off a little bit of this jaw, okay, open up a little bit of that, then I can see the muscle inside. They're actually located at the area of the maxilla, okay, and partly in the temporal bone, but the muscles are actually going from that part to the inner side of the mandible. Those are your pterygoids. Okay, a lot of the medial pterygoid. Okay, I don't know if you remember that the sphenoid bone has the legs. Remember, it looks like a bat and has a leg. The name of the leg is your pterygoid process. So they're the one that grabs onto the pterygoid process of that cadaver or model that we have. Okay, so those are the lateral pterygoids, lateral medial pterygoid. Okay, and remember the buccinator is really part of the facial muscle because it's cranial nerve 7, but it's utilized by the muscle of mastication in order for them to suck on a straw. Okay. All right, so now let's go now to the tongue. The tongue is, again, simple. Remember, the name of your muscle always ends up glossus. And the reason for that is because glossus in Latin means tongue. So it ends up at the tongue, which is actually freely moving to the edge. It's not attached to the bone. So the first thing is going to be the muscle called remember, it has the name glossus. So genioglossus, it actually is the inner side of the mandible. Okay, that's what the genioglossus means. Inner side of the mandible, then it will go up and then turn around. Okay, and that's what the genioglossus does. Now, the second muscle, you have to look for the name glossus, styloglossus. That came from the top and game and actually go again a little bit close to the genioglossus. Okay, and that is going to be called your styloglossus. So, what was the reason why they call it styloglossus? Remember this thing here that looks like a fang? Okay, that is actually the styloid process of the mandible. It's the styloid process of the mandible. So the two muscles that actually, the muscle that hangs there is going to actually carry the word stylo, and it ends at the tongue, styloglossus. Okay. Now there's a last muscle there that ends with the word glossus, and that's going to be between the hyoid bone and the tongue. The hyoid bone is actually a bone that is in front of your throat. Okay, so just when you swallow saliva, you can actually see it lifting up. Okay, so why would you need to do that? In which the throat is actually not, the throat is going to the respiratory tract. The thing about that is the esophagus is attached to the back of where the throat starts. So if I want to actually get the food up, I'm gonna lift my hyoid bone from the top, okay, and grab the food from my esophagus. So that's actually the reason why there's always a relationship between swallowing. So when you swallow, you actually are pulling up the throat because above that is the hyoid bone. And there's muscles that pull the hyoid bone up, okay? And there's muscle that pulls the hyoid bone down, all right? Okay, so we finish with three muscles that has the last name glossus, okay? So that's gonna be your genioglossus, hyoglossus, and your styloglossus, okay? Now, I need a nerve, okay? The nerve is coming out from the brain called cranial nerve 12. This is going to be the hypoglossal nerve, okay? So again, it has the last name called glossal, okay? But be careful because cranial nerve 9 is glossopharyngeal. They're not same, okay? So just remember about the below the tongue, hypoglossal. And they call it hypoglossal nerve, cranial nerve 12. And that's going to be tongue movement, okay? So we actually finish with everything here on the tongue, okay? Now, my question is this, okay? Muscles never push, they only pull, okay? So if muscle only, uh, muscle, because remember, when the muscle contracts, it retracts, okay? So how do you think, is it possible for me to push a car when muscles only pull? They never push. Okay, so that means that is actually not true. The muscles, the rule is muscle only pull, they never push. But if you take a look at your hand pushing onto the car, what's happening is this muscle here, called the triceps brachii, is pulling onto the elbow in order to extend the elbow. Okay, see? So I'm not pushing, my muscles never push. Pulling on the elbow, okay, why my triceps brachii, right? So in this case now, I want you to look here. How do you think I can stick out my tongue if muscles only uh, pull, they never push? So why can I stick out my tongue? Okay, am I pushing something? Not really, because this is exactly what it looks like. So you have your tongue out, your lip, and this muscle here is gonna try to relax it. Then after I contract, and then from there, it will actually bring down the tongue towards the floor of the mouth as if it becomes longer. Okay, and that's the reason why muscles only pull, they never push, even at the tongue. So if I protrude my tongue, it doesn't mean I'm pushing on the tongue. Okay, right? So finish with the tongue muscle. Okay, so those are just charts that you can actually help out for your study. All right, the next one, I'm actually now located at the neck. Okay, so I'm actually located at the neck. So I finished with muscle of the face, scalp, muscle mastication, and then I have the muscles located now at the neck. Okay, and if you take a look at the muscle of the neck, they have two kinds: suprahyoid and infrahyoid muscle. Okay, so who are these muscles? Remember the word suprahyoid. That means those are the muscles that are actually located above the hyoid bone. That's going to be called your suprahyoid muscle. So this is going to be your hyoid bone. The hyoid bone, remember in the lecture, the hyoid bone never articulates with any other bone. Okay, and that's actually what we have here. The hyoid bone. Hyoid bone is bone. It's not cartilage. So the hyoid bone is connected to the throat called the thyroid cartilage. The thyroid cartilage is connected now into the trachea, the tracheal rings. Okay, so now the reason why you're actually pulling the throat up is because when you swallow and then you pull the throat up, you're actually making the esophagus close to that food and grab it. Okay, because remember this relationship between that part, okay, that is going to be the esophagus and the respiratory tract. They're actually just one. So whenever you swallow the saliva, the suprahyoid muscle, the one that you'll see here above, they're the one that's going to pull the hyoid bone up. And when they pull the hyoid bone up, it also brings the esophagus up. Okay, and that's one of the reasons why we have a suprahyoid group and an infrahyoid group. Okay, so all the muscles above here, they're called suprahyoid group. And all the muscles below here, they're going to be called the infrahyoid group. Infrahyoid, below the hyoid bone. Okay, so what are the muscles that can be visibly seen here at the neck? So the first obvious muscle is going to be the sternocleidomastoid muscle. So that actually tells you that this muscle originates at the sternum in the clavicle. Okay, so that's actually where it originates, at the sternum, at the clavicle and at the sternum. So that muscle is called the sternocleidomastoid muscle. Sternocleidomastoid. Okay. Now the muscles that you see here. Okay. So we're just going to be looking at the muscles. So this is sternocleido. Okay. And later on, we're going to have a view in which this is going to be gone. And then the muscles that you see here to the lateral sides of the throat. Okay. I got two. One here and another one here. So those are the muscles that that are actually pulling down. Okay, so I started with down. So I'm starting with the infrahyoid group. Okay, so those are the muscles pull down the hyoid bone. So after lifting it up, the infrahyoid pulls it down. Okay, so the opposite effect. So I'm going to identify these two superficial muscles just covering the throat. So the most superior one is going to be your omohyoid. Remember, omohyoid is really the muscle that goes from the hyoid. Oma means scapula, and then into the hyoid. Okay, so that is called the omohyoid muscle. Now, the muscle here at the front, okay, that is the muscle that they call the sternohyoid. Okay, why do they call it sternohyoid? It actually started from the sternum and ends at the hyoid bone at the end. Okay, that's the reason why they call it sternohyoid. Now, why did they call the one parallel to that that's on this side omohyoid? Because omo, okay, is actually a term called similar to the hyoid bone. Okay, so the omo means scapula. Okay, and then it goes to the hyoid bone. So it actually came from the scapula. So if you trace that omohyoid, Okay, it exits out here again. So that's the reason why we call it omohyoid, because it has to go into the scapula. All right, and then after that, we're going to study the muscles on top of the hyoid bone. So we finish with all the muscles. Okay, some of the muscles I'm not going to be going through it anymore, because these are muscles that are underneath this tube. Okay, so this muscle is going to be underneath the tube. So you just have to decipher it. It came from the sternum, and it actually ends somewhere along here. Okay, from the sternum, and then it ends out here at the hyoid bone. Okay. No, it actually ends only at the thyroid cartilage. So this one, remember the two muscles that are actually along, they actually was here before. So this is actually the location. Okay. So now the muscle that will actually pull the hyoid bone up, these are my muscles there on top. Okay. So if you actually take a look, that your throat is being lifted up and down. Okay, and it's not their fault, but it actually is from the muscle called the suprahyoid muscles and the infrahyoid muscles. Okay, so again, sternocleidomastoid is here. These are the infrahyoid muscle, and then from there we're going to take a look at the suprahyoid muscles here, which is going to be the floor of your mouth. Okay. All right, so the muscles that are visible here onto the suprahyoid is called the digastric muscle. So what does digastric mean? It has two stomachs. Okay, because there's one that has a anterior belly and a posterior belly. So this muscle actually came here from the mandible, and then it goes straight down into the thyroid, or the hyoid, and then it goes back into the lower part of the mandible. Okay, so imagine this: if that muscle is actually contracted, what it's going to do, it's going to pull up that mandible. Going to pull up that mandible. Right? So we finish with sternocleidomastoid, and we talk about the muscles that wrap around the throat, the omohyoid, and the other one is going to be the it's the tip of my tongue. So the omohyoid, sternohyoid. Okay, so those are the two muscles. Right? So I mean, two muscles that are pulling that throat down. Okay, pulling it out would be the digastric. You got anterior posterior, and then you have the mylohyoid underneath. Okay, so that's going to be the mylohyoid, and the digastric. It has two bellies: the anterior belly and the posterior belly. Right. So we finished with the muscle here, and on the neck. Okay, I'm gonna go proceed into the muscles here. Okay, so this is actually a good picture of actually stopping and identifying. So these are the supposedly the muscle of the hyoid bone is supposed to be here. It's muscles that are located at the hyoid bone. Okay, so any muscle that pulls it up are what we call suprahyoid. And the muscle that pulls everything down, those are my intrahyoid. Okay, then I have my sternocleidomastoid. And since this covers the whole trachea, this is going to be my sternohyoid. Remember, they last with the name hyoid. Okay, sternohyoid. And then the one that goes to the lateral side and connects with your area at the scapula. Okay, that's why we call it omohyoid. Okay, and remember, those are the muscles that pull that hyoid bone down. in order for the food to be able to be grabbed by the phosphate gland. Okay. All right. So let's move on to the next one. All right. So these are the muscles that I talked to. Okay. So the main thing is you just want to visualize because I'm going to be just approximating it. So if you actually know what it looks like, then you know where it's going to be the proximal, distal, anterior, posterior. All right, so we're here. Okay, so let me actually make one change here. I just noticed this one. This is not suprahyoid. They're actually called infrahyoid. Infrahyoid group. Sternal, hyoid, sternal, thyroid, omohyoid. Okay. All right, so next, we're now deep. Okay, we're now deep into the neck. And those muscles that are deep into the neck, you can actually see that they actually came from the cervical transverse process. So they came from there, and take a look at it. They insert at ribs 1. This is going to be rib 1, and this is going to be rib 2. So I was wondering what this muscle are for, because it's actually going to be lifting that rib. And guess what? I noticed that people who have asthma would have difficulty in breathing, and that's the reason why they're going to use the scalene in order for the lung to be lifted up and uh, equalize the pressure. Okay. All right. So those are the scalenes. I got my anterior, middle, and posterior scalene. Okay. And this one is still the sternocleidomastoid. I call it SCM, sternocleidomastoid. All right, so moving on. Okay, I'm looking at the back. Okay, now we're gonna actually study the muscles of the back. They're gonna be the erector spinae muscle, but anything that is close to the neck, they call it splenius. And they call that splenius capitis. Why? Because capitis means scalp. Okay, so splenius capitis is going to be those muscles that you see here on this picture. Okay, next, we're going to go into the next slide. Trunk extensions, the erector spinae group, okay, which is located at your posterior. Okay, these are actually coming out to the vertebral column. Okay, then we're going to go forward and take a look at other muscles. Okay, so here is going to be the erector spinae muscle that is located at the back. And this erector spinae muscle, it has a name. Okay, I mean, it has a mnemonics to memorize. The erector spinae group, okay, has the ILS. It has an ILS. Okay, so what is an ILS? I, iliocostalis. It has an iliocostalis. So that's one of the erector spinae muscle. Then next, L, okay, longissimus. Okay, so those are the muscles that climb down here. And then spreads here to the lower back. And then I said the iliocostalis is here. And the reason why they call it iliocostalis is because it is, okay, so let me actually check this out. Iliocostalis, okay? So the word iliocostalis, ilio means iliac bone, costalis means rib. So the muscles are actually inserting into the ribs. Okay, then the muscle is the one that you use for straightening your back. So it's made out of your iliocostalis. Remember, it means iliac bone and your iliac bone and your ribs. Costo means ribs. So I got an iliacosalis here at the lumborum, and then sometimes you got an iliacosalis here at thoracis, because remember it's just telling you the position of the muscles. Okay, so I got L longissimus, and then the last is going to be S, and let's go your spinalis. Okay, so all of this is located at the back. These are all your all your erector spinae muscle. Okay, so it's symmetrical, one on one side, another one side, but they're actually just joined like getting in the skin. Right, so we finished with that one. Okay, and the muscle that you see here, this is going to be part of the appendicular. Okay. All right, so we finished with now the neck. So we're going to start off with now the abdomen, then go up into the chest. So the muscle that you see onto the abdomen, these are what we call six-pack muscle. 1, 2, 3, 4, 5, and 6. Okay, so it's not going to be a six-pack. What they meant is 8-pack. Okay, it's not a six-pack. They actually just used that because back then it looks like a six-pack of beer. We have that tone. So this is 1, 2, 3, 4. Okay, and then we got 4 more on the other side. So it's actually made out of 8-pack. There's no 8-pack for beer. Okay, so next, all that muscle is going to be in the middle. So after that, we're going to go to the muscles that are located at the side. So these are the obliques. Okay. So just remember, the obliques are really 3 separate muscles that protects a person. Okay, even a gunshot wound. So that muscle, those 3 muscles, like Kevlar, the body, the body-proof vest. So not even any bullet can go through it. Okay, because it's Kevlar. So that's how this oblique muscles actually look like. How do they actually become strong? Because remember, the obliques, okay? I'm going to look at the obliques here first and identify, is this external, internal, or the other kind? Now, you see the fibers going this way. And the fibers going that way, it's just like putting your hand on your pocket. I'm going to call that external oblique. Okay? See the fibers are going downward. Okay, so I'm going to use that as my external oblique. So where's my internal oblique? So my internal oblique you need to cut off that external oblique in order to expose the internal oblique. And then their fibers go lateral to medial going out. And that's the internal oblique. So it's just like putting your hands towards your body, going up. And the last one is horizontal muscle, transversus abdominis. So with this in mind, the muscles that are located there is going to be the obliques. Even though the transversus is not oblique, but they got used to the name obliques. I mean, transversus abdominis. So the transversus abdominis fibers are going horizontally. Okay, and then a little bit onto the side. Okay, so we have to go back. Right, so I finished with the abdomen. Okay, and then if you take a look at the cross-sectional view of the abdomen, you got 3 layers of muscle. And then and over here, and some people like to call it the peritoneum, okay, and linea alba, rectus abdominis. Okay, then moving on, finish with the abdomen. Now we're gonna go into the chest. So the chest is the pectoralis major muscle on top of the pectoralis minor muscle. Then we have the serratus anterior. Then we have the subclavius. Okay, so that's going to be at the scapula. All right, so once we actually are at the scapula now, with the chest, you can actually see that the white muscle that you see here that goes around it actually goes around this part here. Okay, that's the pectoralis major muscle. Okay, and then you got this part here also. And I'm going to actually just tell you what it is so that you can actually understand what are those muscles, okay? So the first one is pectoralis major muscle, okay? So it's actually like a fan. So they actually originated at the inferior margin of the clavicle and then also into the trachea. The sternum, okay? Then we're going to include this because it's actually close to it. I'm going to include the word deltoid here, even though it's part of the scapula. That's a deltoid muscle. And then everything here was removed. The chest muscle was removed. So I can actually see the pectoralis minor muscle. Pectoralis minor muscle underneath the major. Okay. And then halfway is a muscle called coraco. Called coracobrachialis muscle. Okay. All right. So I'm seeing in the inside of the pectoralis major muscle, and there's some serratus anterior here. Okay. Moving on. Moving on to the scapula. Okay, and we're going to the back now. So we did the chest, and we did the abdomen. Okay, we did the neck, the face, the scalp. Then we're gonna go into the back, posterior thorax. So what are the muscles here? First of all, the muscles that are superficial is gonna be your trapezius muscle. It looks like a kite. Okay, but be careful because it hugs only at the scapular spine. That is going to be called the trapezius muscle. Okay. All right. So I see my trapezius, then I take it off. I don't see my trapezius, so I'm going to call this muscles. Okay. And then this one, I'm going to call this to rhomboids, meaning square. So I got rhomboid major at the bottom, and then rhomboid minor on top. Okay. Major is more horizontal. Rhomboid major is here. Then you got rhomboid minor. And then this big guy here is called your levator scapulae. Right here. Okay, so three muscles underneath the trapezius: rhomboid major, rhomboid minor, levator scapulae. And then the muscle that you see here is the scapular area. Okay, these are my muscle of the pectoral girdle. This is called your sits, S-I-T-S. And rotator cuff muscle. Rotator cuff muscle is actually the sits. What is sits? S-I-T-S. The supraspinatus muscle. And you know where that muscle goes? At the supraspinous fossa. And then I, infraspinatus or infraspinous. Infraspinous Okay, and then the T is teres minor. And then the S is the one in front of the scapula, subscapularis. Okay, those are the muscles. And then we're finished with the upper back. Now the only thing is the lower back, which is made out of only the latissimus dorsi. Okay, take a look at the cadaver. On this cadaver, I see the trapezius, trapezoid looking. And this is the deltoid. Okay, so I was thinking to go through the rotator cuff, but I'll actually just do it later on because I can see the rotator cuff muscle along here. Okay, and that is going to be the supraspinatus, infraspinatus, teres minor, and the subscapularis. Okay, but we'll do that when we go to the appendicular. Okay, all right. So again, I can see the muscle at the back, the rhomboid major, rhomboid minor, and the levator scapulae. Okay, and here's going to be my longissimus muscle, right? And I actually finished out our first part. Okay, our axial muscles. Okay, so on our axial muscles. Okay, so before we actually go, I want to actually go and take a look at the models. Okay, the models on the axial muscle, and that's the last part that we're going to be doing. Okay. All right, so I'm gonna share that with you. Okay, so I'm gonna reshare it again. All right, so what you have are the it's active sensor, axial muscles, trunk, chest, back. So this is going to be the muscles focusing on the axial one. Okay, so I'm going to start off. Okay, and see if my pen works. All right, and I should be able to write here. Okay, so the first thing is let's look at this small mannequin muscle model. Okay, so we're concentrating on the axial. Okay, not the appendicular. Okay, so this is actually a little bit of far view. So, but the main point about this is I can actually see the some muscles that we went through. The one in the neck, sternocleidomastoid, and the pectoralis major, the chest. Okay, and I wasn't able to look at this part here. That this is going to be the serratus anterior. It looks serrated. It follows the rib. Okay, so the serratus anterior. Then after that, okay, we're gonna look at the rectus abdominis, and this is gonna be the obliques. So how did they actually knew it was external oblique? The fibers are going downward, and that's gonna be the obliques. Okay, specifically external oblique. All right. So moving on. Okay, I'm looking at the upper back. I got my latissimus dorsi. Okay, and then my trapezius is still intact. And those are the muscles back. And my scalp here, occipital is part of the scalp. You can see it back here. All right, and then moving on. Trapezius, trapezoid looking muscle. Okay. Okay, nothing much I can actually show you on this one. So, okay, then the rectus abdominis right here. And then these are your obliques, okay? So I'm gonna see if this is external oblique. Fibers are lateral to medial going down. That is called external oblique. Internal oblique's opposite, lateral to medial, the fibers going up, okay? Then transversus abdominis, the third oblique, is gonna be horizontal fibers, okay? So I see my epicranius at the forehead, sternocleidomastoid mastoid here. Okay, so nothing much on this picture because they're not magnified. Now this is the one that I need. Okay, so again, I'm gonna actually have to do this one, a clock, and I'm gonna look for my res aureus. This is my res aureus, and okay, so all right, so I'm looking at this model. So we're gonna be looking at the muscles for the facial orbicularis oculi, orbicularis oris. Then the muscle that I see here at 1 o'clock, okay? That's the muscle underneath the eyelid, the lower eyelid of that person, okay? That was the landmark. So if you actually know that it comes out the orbicularis oculi, so that is going to be called your ocular nerve, okay? All right, so I'm trying to see something here. All right, so now I got my, that's going to be my levator. This one is the muscle called the levator labii, innervated by the ocular nerve superioris. Then this one is going to be, it's going to the zygomatic. Okay, remember this is my 1 o'clock. This is my 2 o'clock. So that's going to be the zygomaticus. I just say zygomaticus because I couldn't see the two different sizes. Then I got one here. That is, okay. I'm reversed right now. This is 12. This is 11. This is 10. This is 9. So that muscle here is going to be the risorius. Then at the angle, this is not a good model. The angle here is the depressor anguli oris. Then there's another one here. Oh, we're already at the inner side, okay. And then we have another one here. So then 9. This is going to be my 8 o'clock. Okay, and then it's going to be my 7. And then after that, 6. And there's supposed to be one here. Not a good model. That is going to be the depressor labii inferioris. Okay, and then the one in the middle at 6 o'clock, that's going to be your mentalis, straight in at that line. Okay, then I got my sternocleidomastoid. And then the one that wraps around the neck, that is going to be splenius, splenius capitis. Then levator scapulae, you can see it from here. And this is still part of the trapezius. Right, and then this is my temporalis muscle of mastication. This is my frontal belly, right here. Okay, so let's look for another view. Okay, now this is a better view. Okay, so again, round muscles, orbicularis oculi, orbicularis oris. Now, I'm going to use my clock, okay? This is now going to be at 11 o'clock. And, Okay, so these are the two muscles of the zygomaticus. Okay, the smaller one is the minor, and the bigger one is the major, okay, which is going to be the zygomaticus. Okay, and then this other one that actually goes down where the bottom of that orbicularis oculi is, that should be your levator labii superioris. Right, and then here at the angle, okay, then you're gonna call it depressor angulioris. Okay, and then before the last one, it's gonna be my depressor labii inferioris. Okay, right. So those are the muscles that I see here. Sternocleidomastoid again. Okay, and I can see the two muscles here that infrahyoid. This is going to be the omohyoid. This is going to be your sternothyroid. Okay, so it's not a good view. Okay, the back, only the trapezius I can see on this view. Right, again, muscle of the tongue, inner side of the mandible called genioglossus, and then there's going to be a myeloglossus here. Myeloglossus, or what we call mylohyoid. I'm sorry, mylohyoid. That's literally the floor of the mouth. Okay, right, and then another picture. Okay, so just follow the clock. So I'll just randomly. I would go into identification. Okay, it's going to be Rhizorius, straight across, and this is, see, it looks like an angle, depressor angulioris. Okay. Then if somebody would ask me, I would say this is going to be your uh, that's going to be your levator. I mean, remember the first one, zygomaticus. This one is going to be the levator labii superioris. Okay. All right. So better view on the side. Orbicularis oculi, temporalis, masseter, depressor angulioris, the angle. Then beside that is going to be the mentalis, and then frontalis, and the temporalis. I already saw it. And then this is going to be my sternocleidomastoid. Okay, moving on. Now we're the torso. Okay, so pectoralis major muscle still attached here, rectus abdominis, and obliques to the side. Okay, rectus abdominis on the middle, and they call it external oblique because look at the fibers, lateral to medial going down. All right, so here lower, we see the latissimus dorsi. Okay, and this is going to be ahead of us in advance. Okay, again, this is going to be your rhomboid major, rhomboid minor. This is going to be your trapezius. And this is going to be your latissimus dorsi. All right, so sternocleidomastoid, your epicranius, temporalis. Okay, it's hard to actually guess on the face at this point of view. Pectoralis major, pectoralis minor. So just remember, pectoralis minor drops down to ribs 3, 4, and 5. Okay. Rectus abdominis, obliques. This fibers are going up. Okay. So this will be internal oblique. Okay, let me see. It's pointing on number 8. Oh, okay. So I couldn't see it. Well, it's actually the fibers are going down. Fibers are going down. Okay, similar to this one. So that's going to be your external oblique. Okay, not internal oblique. Okay, all right. Okay, so that's actually going to be finishing up the first part. We did tissues, joints, first part of the muscle. Okay, and the next meeting, because today's Thursday. Hope you have a nice weekend. We're going to finish with muscle 2 and muscle 3, and that's about it. Okay, so I put up all the PowerPoints until for the exam, and I think let me actually check out. It's supposed to be the pre-test is already also in there. The lab exercise is already in there. Okay, if not, I'm gonna actually put it in there. So that actually gives you the weekend to actually go start and study ahead of time. Okay, ahead of time. So with your with your first exam, okay, so I'm gonna be manually checking all of that, and because most of that it needs to be manually checked, so you should get the results anytime by Friday evening, and then you can actually log on again. You can actually see the results of the exam. All right. So without any question, yes.
Professor, what time is the makeup test tomorrow?
Uh, is that for the first exam?
Yes.
Okay. Didn't I tell you Saturday?
In the announcement, it says Friday. Is it Friday or Saturday?
Okay. And that's the one that who was not able to actually do the test, right?
Yes.
Okay. So on a Friday, it has to be active at night. Can you do it at like 7?
7 p.m.?
Yeah.
Okay.
So wait a minute. Okay. What's your last name?
Buckley.
Okay. What do I have 7 p.m. Saturday here?
Saturday is fine. Whatever works for you. I
Yeah.
can do Saturday.
So Saturday is good because I might not be here on a Friday.
Okay.
So Saturday, 7 p.m. Buckley, right?
Yes.
Okay.
So will like how the exam was posted, it will just be posted just like that. I can just click on it at 7.
Yeah. So you
Okay.
go in and actually click on it. It's gonna say exam makeup. Okay.
Okay.
One makeup. So that's the one that's gonna be open for you. Okay. And
Okay.
I think those other people actually emailed me also. Okay. Can you email me again about that 7 p.m. Okay. So 7 p.m. Saturday. All right. Okay. So
Yes, thank you.
okay. Thanks a lot. So have a nice evening and enjoy your weekend. But study still. Okay. All right. Study ahead. Bye bye.